My group of patients is pretty much adult patients. Anyone from age 18 to well into their 80s. I think it's interesting that over the years the patient population has changed a lot. We never used to see patients in their late 70s or 80s that came in with spinal problems, and now we're seeing them more and more. And they're healthy, they're active, they're having difficulties, and I think we now have some things we can offer them to keep them functional. Over the years, it's amazing how the spine group has grown. I mean, the number of practitioners now that we have providers is greater than the whole number of University Orthopedic providers was when University Orthopedics started. The nice thing about the spine group is that you have, I think we have 9 physicians, 5 or 6 nurse practitioners or physician assistants. So really, when a patient calls up for an appointment, they're guaranteed to see someone that is really dedicated to treatment of spinal problems. I think that very often when you call for an appointment in a orthopedic group, you're going to see a physician, but they might specialize in sports medicine or joint replacement. And so at University Orthopedics, you really are going to see a spine specialist. Patients come in and we'll see many of them come in the first time they've had a spine problem. They've had severe neck pain or back pain, and they're frightened because most of the time these patients don't really have a precipitating event or an injury. All of a sudden they've developed this debilitating back pain. So a lot of what we do is, after a good evaluation, is to try to reassure them. And a lot of the treatment, even though I'm a spine surgeon, is really directed towards helping them through this acute episode, most of the time relying on just a natural healing process and trying some things that may speed up that process. But only a small percentage really come to a point where they may need, say, surgical intervention. Probably that, we really are concerned about them and really want them to get relief, get back into the normal activities. The thing about spine problems is not only is it painful, but it really limits their day-to-day activities. And we have people now that are very active in day-to-day activities, and we have to do our best to get them functional again quickly. Years ago we would tell patients, well, why don't you go home and rest for a while? Well, you can't tell that to a young mother, young father, because they can't do it. We've had Brown residents and students with us right along, and I think, sure, they look upon it as we're donating our time to them, but in truth, it really is beneficial to us. I think they're forever questioning, what we're doing. Why are we doing this? Isn't there a better way? And I think that's very important for what we do in terms of questioning. Maybe there's a better approach. So I think I love working with the students and residents. I think they really provide an awful lot for us. Yes, my grandkids, they say, well, Papa plays a lot of golf. That's what he does. So, but it's, we're very fortunate. Cherry and I have our grandkids all close by, so we have to spend a lot of time with the grandkids, which is really, really great. And I think that, besides playing golf, I think, spending time with the kids is really, really a lot of fun.